Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G. I'm so excited to talk with you guys today. It's been a beautiful fall day here. I hope you guys are enjoying your October and into November. I'm going to discuss dissolving today. We've had an overwhelming number of patients come in that want to be dissolved. And I want to discuss with you my thought process, what I talk about with my patients, expectation management, okay, expectations, follow-up, and potential side effects. So I should have written that down because I'm not going to remember that, but that's what I'm going to talk about. So hopefully I remember. So why do patients want to dissolve? There's a bunch of different reasons why. And that can be they just don't like the appearance of their face. They don't like how they have transitioned into maybe appearing as though they look unnatural, or they just don't look like themselves anymore. That's one reason. Typically, it's the cheek area that becomes overfilled with then inadvertently a concavity or an extreme concavity of the temples, which is the relationship, right? Their temples may have not started that way, but now due to the extreme widening of their cheek and their mid-face area, they look almost, for lack of a better term, that peanut head deformity that we don't like with the smaller eyes. Patients also express that their smiles are constricted, their eyes feel like they're going back in their head, and they don't like the way they look. That's one. The other one is complications, swelling, specifically periocular swelling. And I've had numerous patients in the past couple weeks with periocular edema, specifically malar edema. It's called chronic malar edema, when you have swelling of the superficial fat pads on the lateral, inferior lateral aspect of the eye. I've also seen some more significant festoons, lower eye bags full of fluid. So that's another thing. The third reason is nodules. That I guess can go under complications. So swelling and then nodules, which you can get from collagen stimulators. You can also get from hyaluronic acid dermal fillers. The beauty of all of this is that, are they complications? Well, I guess. Are they side effects? Okay. But we can treat them. So that's the beauty of it. We have ultrasound. We can diagnose them and we can treat them. So that's what I love about what GFaceMD does and what my team does. But there's a lot of things we have to do when it comes to dissolving any one of these three issues. When patients come to my office, the first point of contact is usually just diagnosis. I want to know how things happened. I wanted to know the progression. I like to see photos of the way they looked before they were injected. And I like to understand why they want to be dissolved. Those are all really important. Let's start with someone who has overfilled cheeks. Why do they want to be dissolved? I had a patient this week who really felt that over the course of the past couple of years, she looks swollen. She looks boggy. Her face feels big. She didn't look like herself in photos. And ironically felt that her lower face was actually aging more quickly and saggy, which as injectors, we typically lift and add to the upper face to diminish the lower face sagging. But she felt the opposite, which was very interesting to me. So picking up on all of these key words that your patients say and the history is critical when evaluating and determining if you're going to actually dissolve a patient. So with this patient, we walked through the steps of how this would go. So let's say we dissolve you today. I typically see patients back in a week after the first session of dissolving, which we are finding research and clinical research is showing that the hyaluronidase acts usually within the first 6 hours of administration. However, I like the tissues to settle back down. Every time we stick a needle in someone's face or every time we put a microcannula in someone's face, there's trauma and there's inflammation. So I like those patients to wait a week before they see me. Will that change? My protocol change? Maybe. But they come back in a week and we assess again. What is the most important thing that, if you take anything away from today, take this away? The most important concept and expectation is expectation management with these patients. They need to understand that, number one, they aren't going to walk away from this experience after multiple treatments of dissolving. They're not going to walk away with zero filler in their face. It's very hard, if not impossible, to dissolve every single bit of filler in these patients' faces. And in my opinion, we don't want to do that. The goal is not to dissolve everything that's been injected. It's to get the patient clinically to a place where they feel confident in their appearance. So it's not all going to be gone. Patients that want all of their product gone, that's a little bit of a concern for me. Why? Is it because they just have this weird psychological relationship with what's in their face and they don't want it there anymore? Well, that's an issue that we should discuss separately. Clinically and subclinically, it's pretty impossible to get rid of all of it. Okay, so that's the first thing. The second thing is that patients are not going to go back to what they looked like before. I want to see their before photos, and I want to look at how they appear today and what they think of themselves today. But it's imperative that you tell them that when they're dissolved, they're not going back to that photo that they quote unquote like of them that was a year ago or 2 years ago. They will likely go through stress, emotional stress that they don't like the way they look, because we're now changing their appearance in a way that they're really not used to, and they may see some temporary accelerated aging, and that's okay. Understanding that you're there with them, that you're going through the process with them, and then once we get to a clinical place that I believe, or my team members believe, we can adjust and structure them in a beautiful way, that's the goal, okay? And that's so important, and it's easier said than done. And if you feel as though as an injector that you and your patient are not seeing eye to eye with this topic and the protocol, then it's probably best that you part ways and just say, let's think about this. Is this really what you want to do right now? It's the holiday season, whatever it is, you have parties, maybe it's not the right time. And then you have the other patient that says, I need it, I want it, I can't wait to feel like myself again. I'm ready to go through this with you, and I feel completely educated on what's going to happen, okay? And then I wanted to give you guys a little bit of a side note on the psychosocial aspects of filler and dissolving. And what we're finding, there's a ton of studies done on the emotional state of patients that are injected. And when people feel beautiful, they are more confident, and we kind of understand that. They're more able to positively interact with the world and their peers and colleagues, friends. They're happier because of that. They smile more. They inadvertently potentially can make more money, okay? You're more confident, you're more self-confident, you're more positive, you smile more. Maybe that brings you more money. I don't know, that'd be a great thing. The other thing that was interesting when I was reading is it actually, a person that exudes these feelings and energy is also more trustworthy. So if you're getting all of these things from having a positive result from product and filler, to potentially take that away from someone, you just want to understand what their mind is going to go through. Somebody that's now feeling, even though they understand that they want to go back to a more normal appearance, you are taking something away, and they will look more tired. They won't feel as bright. Maybe they're not smiling as much. Then things may change in their life. Now, this seems drastic, but it is true. And it's always good to be aware of the potential issues down the road versus be surprised. Hopefully this doesn't happen, right? But I think what I've learned over the past year of bringing ultrasound in, becoming a big educator in ultrasound and a big provider when it comes to dissolving and optimization from both injecting and dissolving, I've really learned a lot, and I love it. I think it helps when you know these types of things to interact with your patients better. They will trust you, they'll honor it, and you're a straight shooter. There's no beating around the bush here. You're injecting someone's face, you're dissolving someone's face, and they want to know what is going to happen. The last thing I want to mention before we say goodbye till next week is safety. Hyaluronidase is one of the safest medications out there. It's been used for years and years and years for multiple different reasons and indications. It is safe. There really are no side effects. You can have mild bruising, swelling. Can you have an allergy? Of course, people can have allergies to anything. But my other issue with doing, this is a whole other podcast, you guys. My whole issue with doing just a skin test to determine if hyaluronidase is going to be potentially an allergen doesn't translate. So we do skin tests for ingested foods, typically aerosolized allergens that are in the air that we inhale. But what about something that's injected into the tissues of the skin? Is that going to translate? Are you actually going to see a positive result with an intradermal small injection of a liquid and look at it for 5 minutes? Is that going to correlate? Are they going to be the same? Is that specific? Is it sensitive? We don't know. We don't know. So can someone be allergic? Someone can always be allergic. I think that we need to understand how to manage those types of issues and complications. Obviously, every practice should have an EpiPen and have standard operating procedures for all of those. It is very, 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 very rare. And I think safety is number one priority for me in every aspect. So allergies, okay. Swelling, bruising, soreness, those are the top 4. And seeing your patients back in a week and managing them. I hope this helped you guys. I hope you learned something from my brain, a little bit of a brain dump and roundabout, but hopefully it kept you listening and not getting bored. And like, subscribe, listen again next week. I'll see you guys there.